Many of you are going to work past 65, and there's probably a lot of questions, a lot of things that you are hearing, whether that's from friends or maybe a Medicare sales agent, something you're reading on the internet, something you've asked ChatGPT, whatever it is. There's probably some points of confusion on, do I need to take Medicare now? Am I going to get penalized? Will I limit my options if I don't do something right now? All of those things have a little sliver of truth. And we're going to share with you truly a step-by-step plan today. If you are planning to work past 65, what you need to do to be able to make sure you get the best coverage you can and set yourself up for the future correctly. I'm joined in the studio today by my dad, Marvin Music. Guys, listen, if at any point you have a question and you'd like to talk to Marvin, who's truly like the leading expert in the country, he's educated more people about Medicare than anyone else. This is your opportunity to call in. Ask him a question about your situation, whether that's Medicare related, retirement related, Social Security related, and get a really expert opinion. I really encourage you to take advantage of this. The phone number is 833-824-2004, 833-824-2004. Call in, get your question answered by somebody who's not trying to sell you something. So much of the information out there today is from people who have an agenda. They want to sell you something. And we're obviously not going to sell you something when you call in. Our goal is just to make sure that you are set up for life, because Medicare can be confusing, and you deserve to know and have the truth. So let's talk about turning 65, going to keep working. What are the steps that somebody needs to take to make sure they have all of their options open in the future, to make sure they don't get penalized, to make sure there's not going to be any gaps in coverage or find themselves without coverage in the future?
All right. So for those that are working past 65, if that's you, the first issue that we look at is the size of the employer payroll. Because Medicare says that if you are working for a company that has 19 employees or fewer, then you are required to take Medicare A and B. So that's the first thing. How large of an employer? And it's payroll size. Part-time, full-time, just payroll size is all that matters. And so you have some specific things you have to do if there's 19 or less. If there's 20 or more, then we're in a different kind of a scenario. So let's work through those of you that have small employer plans. So you must enroll into Medicare A and B. And the reason for that is because the present insurance company that you're covered by at work is going to move to the second payer position. And trust me, many people are not aware of this, but that's what's going to happen. Medicare is going to pay first. The employer plan is going to pay second. So if you fail and you just don't do what I'm telling you to do, and you go ahead and just have the employer plan and you have some kind of a large claim, I guarantee you what's going to happen is that insurance company is only going to pay second and you're going to be the first payer. I have seen this before. It's a huge mistake.
So translating that means you go into the hospital, you're going to be responsible for Medicare's portion, which is 80%.
Yeah.
Right?
Yeah, but it'd be deductible. It would be the 80% for all the docs. Exactly right.
So you're going to pay
tremendous amount of money. And so you become the first payer instead of Medicare. And so that group plan is going to pay second. So you have to enroll into Medicare if you're in that scenario. Now, I can tell you from a practical standpoint, what the majority of people do is they go ahead and come off of the group plan entirely.
Because usually if it's a smaller employer, the plan's expensive or it's not that great.
Exactly.
In a different situation, but
even if it is great and maybe if it's a reasonable price, it's still going to pay second. So what we would encourage you to do is to ask your employer to give you a raise because I know what it costs us, Josh. What we're spending $1,000 probably a month on every employee, and so your employer is spending a lot for that. So what I would recommend doing is going to them and saying, I'm going to go on Medicare, and since you don't have to pay for my insurance premium anymore, could you give me a raise to help offset that? And I will tell you, if you're valuable, we would do that in a heartbeat. Okay. And so
now an employer can't incentivize people to do that.
Not at all. No, the rules are 19 or less. You're making the choice. And I'm not saying we're up to something here. I'm just saying to you, I've seen this happen many, many times in my career. Where an employer will pay some of that. So when you look at it this way, you're looking at a couple $100 for your Medicare B. You could get an N plan or a G plan for $150. Get a drug plan. So you're probably looking at about a $400 package with a very small deductible. You're probably right now paying more than that, or at least your employer is. and you probably have a higher deductible as well. So my point is, you win and your employer wins. And so you have to go on Medicare anyways. Employer goes to second payer position. So you can prove your position by coming off the plan totally and get A and B, get a supplemental plan, or get A and B with an Advantage plan. And so I think that's a very good decision. So that's those of you that are with small employers, 19 or less. Now let's talk about the other of you that would be working for large employers, which is certainly the norm. There's 20 employees or more on the payroll. So in your situation, you don't have to do anything at all. And so you don't have to do A and you don't have to do B. But I would still recommend taking the time to compare your employer plan with your Medicare option. And just so you know, we're happy to do that with you and for you. Just call in and say, hey, here's my employer details. Here's what I'm paying a premium. This is the deductible I have on the plan. This is my max out of pocket. So we want to gather a little bit of information, and we will help you lay those plans side by side and make a good determination whether Medicare makes sense or not.
Because our caller just a few minutes ago, or a recent caller we had, he was saying that he was paying like $250 a month, but he just had a surgery with a $6,500 deductible that he had to pay.
Yeah.
So now
max out of pocket. You're right.
Yeah. So at the end of the day, like, if you can maybe spend a little more in premium, but you get your deductible lower from $6,400 down to.
But his issue, Josh, was his wife was covered. Remember, she was 2 years younger. So the point is, I think we have to bring that into the equation as well. We wouldn't want you to go on Medicare if you're going to. Sometimes spouses have somewhere else to go. Yeah. But if your spouse doesn't have somewhere else to go, or you have children that are covered by the plan, which they are up to age 26, then sometimes you would have to even stay on the group plan, even if you'd like to get off, just because it's going to negatively impact other people in your family. But let's go back to what I was saying. Take the time to make the comparison. Lay them side by side. And so if Medicare makes sense, then your employer has to let you go. And so you just make that comparison. Now, if you do have a spouse or children that are covered in the plan and you have to stay, and that is fine as well. But what you may want to consider is doing A only. And we do recommend A only as long as you're not contributing to an HSA. Health savings accounts are wonderful. Money goes in pre-tax. You put money in. Sometimes the employer puts money in, and that account can grow and can be used for medical expenses. So it's pre-tax. The account grows, tax deferred, and it's tax exempt if you use it on qualified medical expenses anytime in your life. In fact, I had a call last night with a gentleman, Josh. He had, I think he had $60,000 in his HSA. So, I mean, people have accumulated some wonderful money. And I do want to say something about HSAs to those of you that have them. If you have a sizable amount, this is what I shared with him. He wasn't aware of it. What happens is if we take that money out of an HSA prior to 65, we're actually penalizing. You got to pay taxes on it. But after 65, what happens if it's so large and you think you'll never use that money, then you actually can pull that out, pay the taxes on it, but there's no penalty at all. And so
it's just like an IRA.
Just like an IRA.
Probably the last IRA you should tap, though.
And I would agree
like you
with
wouldn't
that.
do that right away.
No.
Because if you have other IRAs, like what you would spend through that before you'd get into your HSA, because that money can always be used tax-free for forever. And maybe you're like 90 years old and you want to take everyone on a cruise, just pull it out.
Yeah, pull it out. Exactly right. But it is something to take advantage of. Back to what I was sharing, kind of got diverted there. But if you're working for a large employer, what happens is 20 or more, then they're going to pay first. And if you did have Medicare, then Medicare is going to pay second. So that's why we're saying if you do anything, take A only. Don't take B. There's no reason to take B. If you have a lousy employer plan, then you should take A and B and get off the group plan.
Now, if you use an HSA, you should not take A.
Don't take A. Don't take A at all. And I promise you will not be penalized. And even if someone says you're going to be, listen, as long as you have paid into the Medicare tax system for at least 10 years, they call it 40 quarters, four quarters a year, or your spouse has, you'll never be penalized on Medicare A. I don't care if you take it at 65 or 95. There's never a penalty as long as it's zero premium.
And we tell people to take Part A because it may pay something, even if you have group coverage, right? It may end up paying a little bit of something, but also it makes the transition to Medicare down the road a little bit smoother.
It does.
Right? You've got a Medicare card, you've got a Medicare number. Now it's just a matter of filling out a couple of forms,
bringing in Part B,
and then starting Part B.
Exactly right.
It's just easier for you.
Yeah. So we do recommend
that you would take
it. Take A. unless you have an HSA. So don't do anything. And then as you get ready for retirement down the road, then you have to stop your HSA contributions a little bit earlier. But I would just recommend don't take A if you have an HSA, and don't worry about people who say you're going to be penalized. They just simply do not know what they're talking about.
The government would prefer that you work till you're 150 years old and they never have to spend a dime on you, covering you under Medicare. So they're not going to penalize you for staying on an employer plan.
Yeah, at all.
They're going to penalize you when you go without coverage, you don't have an employer plan, then all of a sudden something changes in your health and you've got to get on Medicare all of a sudden because they know, oh, it's because there's going to be a financial outlay. It's because they're sick. It's because they got cancer. It's because they had a heart attack. We got to get on Medicare, and now Medicare is starting to shovel out money. That's when they penalize you because you chose to go without coverage.
Yeah, you're right. So if you have a group plan, you'll have no problems.
So this is all great, wonderful. You're going to work till you're 67. We know the plan. We don't have to take A. We can take A. Don't take A if you have an HSA. We should compare group coverage to see if it's better. All that's great. What if they did all that? They decided I'm going to stay on my group plan because it's $100 a month and it's a $1,000 deductible. It's great coverage. Then they get laid off.
All right.
Then what happens?
Okay. Well, and that does happen. And so, number one, don't panic, because we can bring you into Medicare very quickly. And so, for instance, if this happened to you today, you lost your job, and it's May, in May, we can start you by June 1, no problem at all. Okay. So in fact, I have literally brought people into Medicare, the very last business day of the month for the next day, the first. So now we don't have cards in place, but you will be covered if you have a heart attack. So don't panic, at all. So if you are in that position, you lose it, I would get moving as quickly as possible, because we do have to get some additional paperwork, taken care of for you. But again, it's not really a big deal. It's not. The other thing that I'd like to mention to those of you that are on Social Security, very, very important. And also keep this in mind. When Josh and I talked to you about employer, remember, it could be your employer, it could be your spouse's employer. It doesn't matter. Okay. As long as, you're married or, you're covered by that spouse's plan, all the rules that we're talking about still applies to you. So now here's what I want you to realize. If you're on Social Security, you're going to be automatically enrolled in Medicare A and B. So if you're still working and you have a group plan 20 or more, or your spouse does, then if that group plan is good, then we would recommend disenrolling from Medicare B. If you're on Social Security, you have to stay enrolled in A, but you do not have to take B. So when the Medicare card shows up, I recommend to you that you just simply sign on the back of the card, send the card back in, and they'll drop off B. That way you don't have to pay for B, and then they'll send you a new card, Medicare A only, and you can pick up B at a later date. And the reason I'm telling you that is because, in my opinion, it's a waste of money. If the employer has 20 or more, group plan pays first, Medicare pays second. So I wouldn't want to pay $202.90 a month to have Medicare in the second payer position. Yeah. So send the card back in, disenroll for Medicare B.
Okay, let's get to our first caller. We've got Richard from Tennessee. Richard, what are your questions?
Well, I've just I'm questioning options as far as the Advantage plan versus the Medicare supplemental plan. It's confusing, and it sounds like you've got one shot at getting it right without costing you. And how do you make those decisions?
Exactly.
Confidently.
Okay. Richard, first off, I think you have to decide, sir, what's most important to you. And we're all different. I can say this, that if it's most important to you to be able to go to any doctor that you want, then that's leaning towards a supplemental plan. Now, if you're comfortable allowing the insurance companies to pick out your providers, doctors, and hospitals that you can go to, then again, that's the way Advantage plans are going to work. Secondly, if you are fine with the insurance company having some say-so in some of the healthcare needs that you have, such as you may need an MRI, or you may need a knee replacement or hip replacement, or you want to, go to a specialist. If you are fine with the insurance company having some say-so, then you're fine with an Advantage plan. But if you don't want them to have any say-so, meaning you don't want to have to go through the pre-authorization process of the insurance company agreeing with what the doctor recommends, then that's going to be a supplemental plan. And then, because I could go on and on, I'm not going to, but one other thing is, if you would like to have something that's permanent, can never be canceled on you, that's a supplemental plan, because Advantage plans are 1 year at a time only. And the insurance companies can pull them. Last year, we saw over 2.5 million people lose their Advantage plans. No one that was on Advantage on a supplemental plan lost their coverage, because those can never be canceled by the insurance company. Now, I share all that with you because so many times, Richard, people just want to look at premium as though premium is everything. Premium matters, but it's not everything. What really matters is, how do you want your insurance to work? Now, I personally went on Medicare in January. If you've been, listening to us, you would know that. But I chose a supplemental plan because I did not want insurance interference. I did not want an insurance company choosing my doctors. I didn't want the hassles of having to renew plans on an annual basis. So that worked for me. So you have to decide what's best for you. Obviously, if you're going to get a supplemental plan and you get the benefits of that quality coverage, you're going to have to pay a premium to do that. But you're pretty well done. I have already met my deductible this year. It's $283. I'm done. Every service I get the rest of the year, it will be at no cost to me. If I was on an Advantage plan, or if you were on an Advantage plan, you wouldn't pay a premium, but you go to a hospital, it's going to cost you $400 a day. So either way we're going to pay, you just have to decide, would you rather pay as you go, that's Advantage, or would you rather just pay a premium that you can afford, and then you're going to pretty well be done. So that's really what it boils down to. They're both insurance, they're both fine options, but they're different. And now here's the issue. If you decide to go with an Advantage plan and you stay on that long term, you stay on it a year, 2 years, 3, 4, 5 years, in order to get off of that in the state of Tennessee, and for you to move on a supplemental plan, now you're going to have to medically qualify. Now, you don't have to be in perfect health, but I guarantee you this: if you have rheumatoid arthritis, you're a diabetic, you've had any kind of a heart issue, whatever, you're not going to move. You'll be on that Advantage plan for the rest of your life. So those are the differences, and that's the kind of thing you're going to have to weigh out. Now, I want to ask you a question. Have you seen my Essentials workshop on our website?
I have not.
Okay, I would encourage you to do so, sir. If you'll go to Medicareschool.com, and you'll see on our homepage, there's a place where it says schedule an appointment or watch a workshop. Watch a workshop. You don't need an appointment. You need to watch a workshop. It's about 50 minutes long, and I promise you, it will give you all the details, the ins and outs of what you need to be thinking through. And then just decide what's best for you, because there is no right or wrong or best. Okay. Now, I do want to share something with you, just so you're clear. When we have a supplemental plan, we're going to have to pay a premium. My son Josh looked up some rates in your area. Now, just so you know, this rate could be a little bit lower if you're married or live with someone. Those are called household discounts. But basically, the rates right now in a G plan in Tennessee are going to be about $149 a month, $149. The N plan, which is also a great option, is $101. So you're going to see that's about a $50 a month difference between G and N. I live in Missouri. I chose a G. There was only $35 difference. Sometimes there's $50, sometimes there's $70 or $100 between G and N. But I think both are great options. The difference would be your G is going to be the most comprehensive plan. Covers everything but B deductible. You meet that once a year. The N, you've got some copays when you go to the doctor. You're responsible for the deductible as well as excess charges. Now, the reality is, Richard, you're probably not going to see an excess charge, but if you did and you had an N plan, then you'd have to pay that extra 15%. So those are the differences. Any other questions that you have for us, sir?
Well, that's just, that's costly. For one person, that's not too bad. But like you said, I have a wife, and so I'm going to be spending. If I go with the G plan, if I go, it's going to end up costing me about double what I'm paying for my health insurance today.
Yeah, and that could be the case. Medicare is definitely not always cheap. But I do want to remind you this, whether you go with an Advantage or a supplemental plan, you still have to pay that Part B premium. So that's going to be the same.
Absolutely.
Yep, exactly right. So you could have
Sure. $400 right there for two of you.
Exactly right. So, and yeah, I'm not minimizing the pain of that for sure. But again, Advantage plans are still fine insurance. It's just a system that's a little bit different, and we want people to make sure they know what they're getting. Okay. And so, anything.
Well, neither one of us will be able to go with the Advantage plan. I'm diabetic, and my wife has other issues as well. So,
Are you all both going to go on Medicare around the same time?
I will go on it. Well, that's to be determined.
Sure.
I should go on it 2 years before her.
Okay.
Okay. Now, Richard, are you still working, sir?
Yes, full time.
Full time. And are you planning on retiring anytime soon?
My goal was at 67. I just turned 65 in April.
Okay. Yes. All right. Sounds good. So you're going to work 2 more years then.
Till your full retirement age, probably, right?
That's the plan that we've had. My wife is ready for me to go on and retire. She retired for health reasons.
Okay.
She retired for health reasons 2 years ago. She's younger than me, and so she's not on Medicare yet.
Okay.
When will she be eligible? When does she turn 65?
She said 2 years.
In 2 more years.
2 more. Okay. So yeah.
That's why I was waiting till 67.
Sure,
Right.
sure. Now, your employer plan, is there at least 20 people at the company or more?
Oh, yes.
Okay.
We have 11 locations nationwide.
All right.
We probably have,
multiple thousands. That's good. I just want to make sure you're on a large employer plan, so that's very good. What does it cost you right now to be on your group plan?
It is about $120 every 2 weeks.
Every pay period. So about $250 a month then have both of you covered. You're right. You're going to be spending more when you go on Medicare. But I would say this, I would suspect your deductible is probably a little bit higher than $283. So you'll probably
yes. Oh, absolutely. I had surgery in February, and my out of pocket was $6,400 for me.
Yeah. And you divide that by 12, there's $500 a month right there. So it's going to cost you a little bit more to be on Medicare when it's time. And really, there's no hurry. You've got a great plan. Just remember, Richard, when you come into Medicare, all we have to do is verify that you've had credible insurance back to 65. Very simple to do. Well, there's a form we fill out, and of course, we'll help you with all this when it's time to do it. But
did you take Medicare Part A
in April?
Yes.
Okay.
Good.
Yeah, that's good.
I just signed up for it. I just signed up for it in April.
Okay, that's great.
Gotcha.
Yeah.
And you don't use an HSA, is that correct?
No.
You're not contributing to one. Good.
Yeah. If that ever becomes available, if you have Part A, you can't use an HSA. So just in the future, the next couple of years.
What is an HSA?
It's called a health savings account. It's basically where you have a high deductible, then the employer puts pre-tax dollars into an account, blah, blah, blah. You understand.
Yeah.
So,
all righty, sir. Well, listen, we appreciate the opportunity to talk to you. And when it comes time, let me tell you what I would do, sir. 90 days before you get ready to retire, that's when you need to get serious about getting enrolled. You can't do it 6 months in advance, even if you want to. Medicare will not process that B paperwork. It's called a special enrollment. So 90 days is the perfect window, excuse me, as you approach retirement. Set the date, back to the clock 3 months, give us a call, and we'd be really privileged to be your broker.
Perfect.
Okay, Richard. Appreciate you calling in today. Nice talking to you, sir.
Bye-bye.
Bye.
Thank you. Bye.
If you ever need help with Medicare, it's a big confusing world out there. There's a lot of people trying to sell you things. There's a lot of misinformation floating around. MedicareSchool.com, we are a team of insurance brokers, right? And if you need help, we would love to help you, whether that's getting a Medicare supplement plan in place, deciding between a G and an N. What are the lowest rates from a good rate stable carrier? What drug plan do I need? If you're going to go an Advantage plan. I look at Advantage plan options all the time, and you type in a zip code, and there's 50 different Medicare Advantage plan options in a single zip code. It is very confusing to understand what is the right coverage for you. So if you need help, we would love to help you. I'm going to give you our office phone number. It's 800-782-6676, 800-782-6676. When you call in, you're going to be speaking to one of our licensed agents. These are all people that are trained by Marvin. And what we think is important is people who are go ahead.
And if you're wondering if there's any cost to our services, the answer is no. I have many times people say to me, well, it surely costs something, and it doesn't. We're no different than your homeowner's insurance agent, your auto policy agent. They are paid by the insurance company, and so are we. So we truly are free to you. So relax about that. I mean, all the services that we'll provide for you, enroll you into Medicare, help you with SCP paperwork, all those kind of things are truly at no cost.
Okay, let's go to our next caller. Diane in Florida wants to discuss supplemental plan G versus N. Diane, can you hear us?
Yeah.
Hi there. What questions do you have?
Hi. I am kind of looking for an opinion. My husband
Well,
and I
you've
have
come to
both
the
received
right
healthcare
place
from-
if it's about Medicare. We've got a lot of opinions.
Okay.
Go ahead.
So our whole adult life, we've had care at a major medical center that was one of the last that started to not accept assignment.
Okay.
We're debating the N plan versus the G plan. We would like to continue to get care there, but that 15% excess fee kind of scares us. I don't know if the government has put things in place that most institutions will not go back to that. So I don't know if that, truly is something that we need to fear in the future, or
Well, I would say this.
if
Diane, I don't think there's a tremendous amount of fear there, okay? But it still could happen. You may never encounter one. The likelihood of you ever encountering excess fee is very low. I think less than a 3% chance. So I don't think you'll see it, but you still could. It would be wrong of us to say to you there's no risk involved, because there's a slight risk. Okay, I think what it boils down to, there in the state of Florida, excess charges are allowed. It's not one of the 8 states where they can't even charge it, but the likelihood again is going to be small. So if I were you, I would look at my budget, because I know in Florida many times, and Josh is going to run some for you. What is your zip code? Do we have that? Okay, good. I guess we have your zip code already.
Yeah.
So he's going to look up some rates, but there could be as much as $75 to $100 a month difference between the G and the N. And so I think that's what I would look at if there's a substantial. You probably heard me say I live in Missouri. The difference is $35 a month. Not significant, but there can be in fact, I guess right now Josh is saying the difference is about $50 a month between the G and the N in the state of Florida.
So for times 2, that's $100 a month, $1,200 a year.
Yeah, $1,200 a year. So we're not talking 20,000 here, but it's still significant for sure. And so I think for me, I think number one, you're wise, and you know a supplemental plan is going to give you your premium, really best insurance, in my opinion. I love the subs because of no hassles, and you have the freedom to really be in control of your health care instead of some insurance company doing that. So I think you're making a good decision there. So I don't think it's bad either way. Look at your budget, say, hey, we can afford the G, or that's going to make things a little tighter. Then I would say get that in plan, because it's a great plan.
Okay. With regards to the 15, is that for absolutely every test, procedure, everything done at that facility, or that is just a physician charge?
Physician only. Yeah, hospitals can't add to it. Durable medical, no one else can add to it except for your physicians, which would typically be in the cancer field is where we see it more than anywhere, and that would be a specialist. It could be a surgeon. Then they could add the 15%. But just so you know, what happens is when they get their original reimbursement from Medicare, they actually are only going to get 95% of the original Medicare price. So it's truly just an additional 10%. I mean, it's truly 15% added, but at the end of the day, they don't get the full 100%. They get 95% reimbursement. That's the way it works.
Yeah. Okay.
So, but look at your budget. That's what I would do.
Okay. Yeah, we had kind of looked at the prices in our area. My husband is also applying, and his is like a $65 difference So it was a little bit less for me, probably female versus male, but, we just didn't want to get hit with, thousands of dollars in the future if they reversed, that Medicare assignment.
Exactly right. And there is some risk involved in that. Right now, we know less than 3% of doctors do it, but that could change during yours and my lifetime. I hope it doesn't, but it could for sure. Diane, is there anything else that you want to ask us? We'd happy to talk about anything else that's on your heart and mind today.
No, I think that's it. I appreciate your taking the call.
Okay, good. If we can help you in any way, please let us know.
Thanks, Diane.
Okay, thanks so much.
Yes.
Okay, let's get to Kevin in Oregon. Kevin in Oregon. Welcome to Medicare School Daily. What questions do you have, Kevin?
Well, I won't personally be on Medicare till June of 2027.
Okay, next year.
My wife starts December, and so we've been looking through the Medicare.gov. We've been watching you guys, and you guys are awesome.
Well, thank you.
Appreciate the encouragement, sir.
Yeah, you've educated us well.
Good.
So anyway, my problem is I take two medicines that are pretty high dollar medicines. One is eplerenone, one is Repatha.
Okay.
And I've heard Marvin say a few times on some of the other shows that there really is no reason for anybody to ever have to pay over like a $50 copay for Repatha. But when I look at the Plan Ds, they're showing like $1,695.
Okay,
so I don't
do me a
know
second.
what plan that is.
I'm going to pull this up. So Repatha, what's the what was the other one?
Eplerenone.
How do you spell that?
EPLERONE, I believe.
Oh,
yeah,
okay, sounds good.
Hey, do me a favor. What is that eplerenone for? What's that prescribed for?
It's a blood pressure medicine. And so my problem is I can only take this group of medicines that I take.
Okay.
Because I'm allergic to a lot of other medicines.
I see.
So it's very, very vital I take these.
All right, gotcha. And then what's the Repatha treated for? I've heard of it.
For like what? Yeah, cholesterol.
Okay. Very good. So it's not a statin. You probably couldn't take a normal statin. No. Is that what it is?
No, I can't take statin.
Okay.
Yeah, it replaces a statin.
Do you get it comes in a pen that's sold in a pack of 2, is that correct? And you get one fill of that every month? I mean, you use 2 pens a month?
Yes, I use two pens a month, yeah.
And that's the Repatha?
Yeah, that's
okay. All right. And so as Josh is looking those up, let's clarify some things, Kevin. Okay, so here's the way it works.
One question.
Okay, go ahead.
25 on the eplerenone, 25 milligram tab once a day? Or is it a 50?
I think so.
No, it's 25.
25, okay.
125 a day, yeah.
Yep,
Okay.
125. And then what pharmacy do you usually go to?
Well, we usually use Walmart.
Walmart, okay. Sounds good.
All right,
toss
Josh.
a couple
Yeah, and
others
that's in
but we're good.
Redmond, Oregon, if that matters, yeah.
Yep, Redmond, Oregon. I got it.
All right, so let's talk about the structures. He looks these specific plans up. So when you're on a standalone Part D plan, which means that it's a plan you selected, it's in addition to your Medicare supplemental plan. If you were to get an Advantage plan, then they embed a drug plan as part of that. So we're talking about standalone drug plans here. So the way they're structured is this. There could be, and usually is, a deductible. That deductible this year is $615, $615. And so that deductible is definitely going to apply to these medications. So you would be out of pocket this first $615 unless the plan waives the deductible. And the reason they would do that is because there could be a higher premium. So sometimes when we have a premium that's, $50 a month or $100 a month, and sometimes those deductibles are waived. But my point to you is that we have to deal with this deductible. Either you pay it out of pocket or the plan waives it. So the first $615 is on you. After that deductible is met, then we move into what's called the coinsurance phase. This is called the initial coverage by Medicare. And so what happens here is the max that they could charge you would be 25% of the retail. Okay. Now, that doesn't mean they're going to charge you that, but they could charge up to 25% of the retail. And so what happens is we add our deductible and we take our 25% coinsurance or whatever our copays are, all that money out of pocket can add up to $2,100 max. and that's
Right.
it. Okay, so no matter if your meds are $30,000 a month, it makes no difference. You'll never pay more than $2,100 for the year, as long as that medication is within the formulary. Now, that $2,100 does not include your premium. That's different, but it does include all out-of-pocket expenses. So I just want to clarify that, because you made a statement there about Marvin said about $50, and so there are some meds that are $50 a month, but there are some where you're going to have to meet the deductible, and then you pay the 25% coinsurance. Okay, Josh, what do you have for us? Okay,
Yeah,
Josh.
so it looks like, the Eplerone is not, I guess it must be a brand name, but it's not super expensive. Walmart's like $37. I don't know if that sounds right to you. Yeah, and a copay. The Repatha.
Really? Okay.
Yeah, the Repatha is, it's got a retail cost, I believe, 12, I mean, it's pretty expensive. So you're going to pay a percentage.
Yeah.
What Medicare.gov is showing is that obviously the first month you're going to have to pay your deductible, so that's $615. And then after that, for both of those meds combined, it's going to be about $105, $108 per month.
And then the Eplerone I also notice is like not in the formulary of a couple of, we don't have a lot of, you can see there, we don't have a lot of insurance companies. I think there's 12 or 10
there's
or something
10,
like that.
There's 10 drug plans, yeah.
Yeah, and I saw 2 or 3 of them had Eplerone not even in the formulary, so I didn't know how easy that would be to get them to do it if it's a company we want.
Yeah.
Yeah.
I mean, it's listed as a generic. So I pulled up United Healthcare.
Yeah, it is listed as generic. Yeah.
What I'd recommend for you, sir, is you want to get a plan that's going to cover that. There's some that will, then you make a decision based upon that. And these online tools actually will shop all the plans, put them in order of cost and coverage. And so we would typically say to you, be sure to just pick the plan that's at the top. Which one, Josh?
A UHC plan. So it's $38.40.
Okay, and that is on a monthly premium?
Yeah.
Okay.
$38.40.
All right, so you've got your
meds are covered, and then it says, are you starting you're starting Medicare next year.
Next year, exactly right.
So I mean, for the rest of the year is about $1,500. So my guess is he's going to hit that cap being on Repatha.
Yeah. What was the retail cost of Repatha?
$1,200 or something.
Okay. Yeah. So more than likely you'll hit the cap, which is wonderful.
That's what it's there for.
Exactly.
Yeah.
It used to be you'd have to.
Then it doesn't cost anything, right?
Good. Hey, Kevin, anything else, sir, that we can talk about with you? Any other questions?
Well, we are we'll both be using you guys, and I just wanted to let you know that because you guys have just won us over. So.
Okay.
Well, thank you.
We are glad, and
keep up the good work.
It will be our privilege. Last question for you, sir. Now, are you still working? Or have you already retired?
No, we're both on Social Security. We're both retired.
Okay.
The only other question I would have is on a spousal benefit. But I don't know if you guys have time to go into something like that.
Well, go ahead.
Sure, go.
Ask away. We're happy to discuss it.
Well,
sir.
so Bambi started, she's 6 months older than I am, so she started her Social Security 6 months before me. Mm-hmm. Then I came in, we both retired. And so she only gets about $877 a month. Mm-hmm. And so we were thinking about, because we both want to go with a G plan if we can. They're kind of expensive, but we don't want Advantage plans because we live here in Central Oregon. In Central Oregon, the main hospital group that runs everything, it's like has the monopoly, is dropping a whole bunch of companies out of their Advantage plan coverage.
Yeah.
Mm-hmm. And we also like the supplemental. We really like Plan G, really like Plan N, except for the cost of Plan N. So anyway, we're just wondering if she could, what it takes to know if she qualifies for that.
Okay.
For
well, here's my question to you. Have you all been married more than a year?
Yes, 41 years.
41, I guess so. So you had to be married more than a year. Now that you have applied, now that you're taking your own Social Security, she would be eligible for spousal. Let me explain how this is going to work for you. Spousal benefit would be her spousal benefit. It would be 50% of whatever you are eligible for at your full retirement age. Not what you're taking now, but at your full retirement age. But if she took hers before her own full retirement age, then there will be a reduction. It's going to be reduced.
Yeah,
So,
like 30% or something.
well, it's actually higher than that. Spousal benefit is 9.375% a year for the first 3 years, and then 5% after that. So it's a hefty amount. But again, let me ask you this: what is your full retirement age benefit? Not what you're taking now, but you know what it would have been if you would have waited to 67.
No, I don't know. I don't know how to find that information. Yeah, I don't know where to find what it would have been.
Okay, then what I would do is this: I would call Social Security. Call them directed. They'll have all the information for you, and they'll transfer you who knows where around the country. That's the way their system works today. And say we're considering my wife taking spousal if it's going to be more, and even if it goes up, $200 a month or whatever, it's certainly worth it. But they will tell you that because they'll calculate it probably right over the phone, or at least set an appointment for you all to be able to see if indeed they can increase that, and they will do that if it will be more. Okay, and the reason I'm sharing all this with you, you probably found out that she wasn't eligible for spousal until you applied. The old system, we could do that, but no longer. So you're thinking right. So call them.
Yeah, we both. Okay, because we've both been on like a year, 2 years.
62.
Yeah, we went at 62 and we're 64. Yeah, so we've been both on at 60 for 2 years.
All
so
right. Well, they'll do the calculation for you and let you know if there's more, and then you can apply right over the phone, typically with them, or they'll set an appointment up to transfer from her own retirement benefit to your spousal.
Cool.
Okay.
All right. Well, thank you guys very
Kevin.
much.
Yeah, we look forward to helping you in the future, Kevin.
See you in December.
Yeah, sounds good,
All
sir.
right.
Take care.
Hey, are you there still?
Bye-bye.
Yeah.
Yeah.
I was just going to give you one little tip. So you should, December, if that's when she's wanting to start Medicare, which it sounds like it is.
That's her B date, yeah.
That's her. Okay. Obviously, that's the annual enrollment period. So it is crazy time, basically, for anyone who works in this business and for everyone who started trying to start insurance around that time. So here would be my recommendation. Call our office, and I can give you that number if you don't have it, but call in probably. Do you have it?
Yeah, I have your number, and we already made an appointment.
Oh, you already did. Okay,
when September.
That's all I was going to say. Okay.
September 1st, yeah. See, you guys taught us that.
Okay, sounds good, because it gets a little bit crazy. Okay.
Right, and her card.
Cooper, a nice guy named Cooper told us that. So
yes.
Okay.
Yeah, Cooper's great.
That's wonderful.
Yeah.
And remember, her card will show up in August, about August 20th.
Okay.
Because she's on Medicare, already on Social Security, so the card will arrive in August, and we're looking forward to helping you, sir.
Oh, yeah.
Okay.
Yeah. We are looking forward to you helping us.
Okay, all right.
Take care. Bye-bye.
Thank you.
When you start Medicare, you oftentimes are thinking about what to do with your IRAs and 401ks and 457s and all these retirement accounts, because you're going to be living off some of this money that you saved. But there is a big tax bomb that a lot of people don't realize, even financial planners don't understand as it relates to Medicare. And so we're going to be talking about that in tomorrow's program, so you can be prepared for that, so you don't unintentionally do something that causes big tax liability down the road. So join us tomorrow. If you have a question for us, maybe you have an experience as it relates to Medicare or Social Security, and you want to share that with us, we would love to hear that. All of our audience grows and gets better together when we know more things that are happening out there in the real world. So if you have a question or an experience you'd like to share with us, we'd love to talk to you. The phone number is down there at the bottom of the screen. It's 833-824-2004. And if you need immediate help, meaning you have a need to sign up for insurance, whether that's an Advantage plan, a supplemental plan, a drug plan, a vision plan, a dental plan, whatever it is, we'd love to talk to you. So if you need help with a Medicare supplement plan, a Medicare Advantage plan, a Medicare prescription drug plan, whatever it is that's Medicare related, you've come to the right place. We can help you. And so we'd love to do that. Our phone number is 800-782-6676, 800-782-6676. When you work with us, you don't pay us anything extra. We don't upcharge for your insurance. We're never going to send you an invoice. We're here for life. I think the most special thing about it, when you become our client, you are assigned a dedicated client care manager. This is someone that when you move or you have a billing issue or a claims issue or anything comes up in your Medicare journey, we are able to help you. You can call the same person over and over and get assistance. So give us a call, 800-782-6676. We have people standing by ready to help you navigate this crazy world of Medicare.